Court. I'm here with Jonette Biebensheimer and Dr. Kedar Prasad. We are so excited about tonight, but first we have a little bit of housekeeping to get out of the way. I'm going to read our statements. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider. Well, with that out of the way.
Yes.
Okay.
Can you get Dr. Prasad spotlighted, please? There we go.
There we go.
Thank you, everyone. We're going to go ahead and kick off tonight's Optimal Longevity series with, I think, the topic we've been waiting to discuss with Dr. Prasad. For you individually got to talk with Dr. Court about your latest paper on Alara and Primara and protection against EMF radiation. And then we did a call on EMF hypersensitivity, but tonight's really the call, I think, the culmination of your novel approach and to be able to help people know that you have strategies to be able to help protect people. And so it's going to be an excellent call tonight. And I've never been more excited to be on a call than I am tonight, Dr. Prasad, because it's going to bring hope to a lot of people who are very fearful. Okay, I'll speak up a little. With that, let's go ahead and get the presentation started. I'll screen share. And I have to. I can't see that. To play here, it's play right here. A novel approach to EMF radiation protection with Dr. Kedar Prasad. Host Dr. Russell Court and myself, Jonette Biebensheimer. And we've known Dr. Prasad a long time. So some of these pictures are pretty old of Dr. Prasad and I there. I'm not sure when that was taken.
9 years.
8 or 9 years ago.
Yeah.
And then we have a picture of Dr. Court and Dr. Prasad. When was that? Is that his 88th or 89th birthday?
That's his 89th birthday. This was last January 8th.
January 8th. And then we have a picture of our family and our service dog, Kaizen, who was actually trained to be able to help Dr. Court when he's around EMF exposure. And so he's actually trained for his pheromones and for behavior.
Good.
And that picture was taken at 12,000 feet in the mountains.
Yep.
Oh, wow.
Yeah. So here we go. Dr. Court, would you please do the honors tonight and read Todd's accolades?
Well, Dr. Prasad has many accolades, but in our science brochure, we have a few that are highlighted. First off, Dr. Prasad is the world's first PhD radiological biologist, graduate of University of Iowa, Iowa City. And if I'm correct, you graduated 4.5 years ahead of your classmates. Is that right?
True. That's true.
Dr. Prasad also discovered the anti-cancer potency of vitamin E succinate, and he was also the discoverer of butyric acid, a small fatty acid formed by fermentation of fibers in your gut, and it's also an anti-cancer agent. Dr. Prasad taught for more than 30 years at the Colorado School of Medicine in Denver. He was the director of vitamin and cancer research. He's also the former president of the International Society of Cancer and Nutrition. And he was invited, I believe, in 1982 to sit on the Nobel Prize nominating committee for candidates in medicine. And following graduating 4.5 years before all of your other classmates, he was sent for his postdoctoral training at the Brookhaven National Laboratories in Long Island. Dr. Prasad has published over 33 textbooks. He has published more than 250 peer-reviewed articles, and he's not slowing down.
No, he's not.
And he is listed more than 450 times in PubMed. It's with great honor and reverence that I welcome Dr. Kedar Prasad to the Optimal Longevity series.
Welcome, Dr. Prasad.
Thank you, Dr. Court and Jeanette. And I always enjoy being with you and Engaged Family. And whatever I can contribute, I will be more than happy. But I want to say first that the whole issue of this thing that I wrote, it was stimulated by Dr. Court and Jeanette because I was totally ignorant about EMF radiation until he started discussing, and then I started doing research, and then the consequences of that research for several months emerged a new idea how to protect against the EMF radiation.
Thank you so much, Dr. Prasad.
All right, so this call, and apropos, is called the Optimal Longevity series. And even though we're like, what are we going to call this thing? We looked at each other and realized we're pushing 60, which I know you think is a kid, Dr. Prasad, because, you're almost going to be 89 plus. But to us, this was a really important name because we really want people to have optimal longevity,
Right.
like you have, and still serving your purpose.
Yes.
Your lifespan is how long you live, but your health span is how many years you live a healthy, vibrant life.
Exactly.
You want your health span to equal your lifespan. And today, the very top part of this this image is our normal aging. And then we have these age-related diseases that we're seeing at younger ages, 30 and 40 years old. We're
Yep.
seeing biological ages of 70 and 80. And I know we have a lot more stressors, Dr. Prasad, and we're going to talk about those in a few minutes. But we want people to have the bottom half, this optimal longevity where you're out living, right, a resilient, healthy life. So with that, any comments on that, Dr. Court?
Nope. I want to just, like you said, I actually knew someone who skied well into his hundreds.
Wow.
I think it was about 100 and I can't remember. He was well over 100 when he had to lay up the skis. And, that is really optimal longevity.
Excellent. And also being sharp, like Dr. Prasad, still publishing very, very important papers and writing books.
Well, that's really truly it. I mean, and you have a new paper that you just published or is in now review. Maybe we'll have a chance to talk about that tonight.
Yes, for next week. All right. So Dr. Prasad, we had a little talk, Dr. Court and I, wanted to talk about health risks because you talked about this in many of your textbooks about health risks. And there are numerous ones out there. And we've talked about human behavior. But I wanted Dr. Court to touch on this first before we go into the research, because I think it's really important why we're really here and this piece. So go ahead.
Well, Dr. Prasad and I both like Hippocrates. So Dr. Prasad, you always quote Hippocrates. What is your quote?
That all the disease begins in the gut.
That all the disease begins in the gut. And my quote from Hippocrates was, before you're asked to heal someone, first ask them what they're willing to give up that made them sick in the first place.
That's very interesting too.
And so go on, Jet.
Well, I wanted to talk about tonight is that very first step of education and awareness, and that we're coming to you with not just thin evidence. We're coming to you with a peer-reviewed paper that Dr. Prasad, the very first PhD radiation biologist, wrote on this topic so that we can start education on EMF radiation and how it affects our health. And we need to start coming up with strategies to be able to provide them to the public. But again, this is about education and human behavior, right? Dr. Prasad talks about, we've been talking about these things for years, and there's still a part of the population that's still not going to quit smoking or certain behaviors. But so Dr. Court, why don't you talk about the smoking just a little bit, and then how dovetail that to where you think we are with EMF radiation? And I'll pipe in a little bit, and we'll ask Dr. Prasad too.
Well, all of us remember, well, at least I remember, I don't know if your parents did this, but I remember sitting in the back of the station wagon gagging as both of my parents are smoking with the windows up in the car. never thinking that it was really that big of a problem.
And hurting their children, because back in the 60s, even the doctor said it was safe to smoke.
Yeah, I mean, I heard I still remember testifying before the Congress. Doctor was saying, no, it is safe. It is not addictive.
Right. And now we know that it's
20 years, 30 years later.
Yeah, nicotine is one of the most addictive drugs that we've been exposed to. And I pulled up a few a few thoughts on this, and that is that I think smoking is one of the hardest habits to quit. And it's ubiquitous around the world, and we've seen millions and millions of people die as a result of that behavior.
Yep.
And it hasn't been that long. In fact, it's in our lifetime that we would sit on airplanes and there'd be people smoking throughout the airplane.
Chimney. Yeah.
You know, it was just thick. It was in the 70s that people did that. And even today, we see a lot of our kids smoking and vaping. And you wrote a paper on this that we've highlighted once, but we can go back to that. But when we look at smoking and the fact that you had just said that everyone, scientists alike, said it's safe. You don't have to worry about breathing smoke into the lungs and having the alveoli affected. And there's no cancer risk. And now that's been definitively proven to be not true, that smoking does cause cancer. And even secondhand smoke causes cancer in a smaller population. Would you agree?
I didn't hear it because we were not.
Did we cut out?
Yeah, I think so.
I'm sorry. So let me try this again. Mm-hmm. It's well published that smoking causes cancer.
Yes.
And it's well published that secondhand smoke also causes cancer. And yet we were told there's no problem with smoking, even in airplanes and cars and things like that.
And even physicians, for everybody on this call, it was considered safe. So we wanted to just really start with that point and where we are today, many years later, right? Mm-hmm. And now we're on the next big stressor. And by the way, Dr. Prasad is an expert of risk factors that affect cancer: smoking, heavy metals, many different things. But now we're dovetailing in to a stressor that it was a few years ago that people said EMF radiation is safe. And it was, now we have enough evidence, and with Dr. Prasad's paper with 89 citations in it, we're getting enough evidence to be able to show the health effects from the exposure. And so, but just as smoking, and help me if we're not getting this point across, Dr. Prasad, we wanted to talk about, it was in our lifetime, that they said smoking was safe. And now we know we have a lot of peer-reviewed evidence, and that you've talked about and documented in your books and papers that risk factor causes cancer. And so now we're coming to EMF radiation, and it is a toxin and a stressor that we need to be discussed. And so on this call, even though we've talked about lots of behaviors, we're here to start educating that this is a health risk, and that just like smoking, at one point it was, people just said it was safe, and we now have enough, I think research is building to say that is untrue. And we're really grateful for you, Dr. Prasad, with the paper that you wrote that we're going to be going over, to be able to help people to know that we now have strategies with your body of work and your evidence to be able to talk about how we can be able to reduce that EMF risk exposure.
You know, Jonette, just a second, Dr. Prasad, when I started in medicine back in 1984, working in the hospital and on the ambulance, everyone in my crew smoked. And a real changing point for me was when our crew chief had a bilateral collapse of his lungs, because he was very skinny and he was a chain smoker, and his lungs collapsed, and we had to pick him up. But you go into the hospital and everybody's smoking in the hospital. And this is the exposome of our health.
Mm-hmm.
And, well, in our lifetime, people start smoking very early on.
Yeah.
I mean, kids try smoking, as young children, and then smoke in high school and smoke in college. And this is the exposome. And now we can dovetail that exposome, or all the things that happen to you in your lifetime, into EMF and the electromagnetic fields that we're all exposed to. Because I started feeling the symptoms of EMF back in 1999.
Mm-hmm.
This has now been 25 years ago that I started feeling it.
Okay, so Dr. Prasad, what is the real root of smoking that causes the cancer? Is it oxidative stress and inflammation?
That's the main one. Yes. Not only that, but in the lung, smoking, they also have tiny particles. And that you inhale, then that tiny particles get inserted in your lung, and that is difficult to get out. And so alpha particles, they call it, which is a highly radiation damage. So a smoker, not only getting a oxidative stress through all these kind of things, but lung accumulates gradually over a long period of alpha particles. And alpha particles is a high LET radiation, is 20 times more damaging than X-ray. And it has a short distance, alpha particles in the gut. So it's a combination. And again, alpha particles produce also a lot of free radicals and inflammation. So a combination factor, there is a dramatic increase. And if you measure the oxidative stress level markers, say, for example, of oxidative damage and inflammation, and this has been published, and they have a lot in the blood of smokers. They have been established. So the question is, but when I was working in the radiology department, at that time, everybody was concerned about radiation. For a state, it was not every population involved like EMF, is the whole population involved. But there, radiation worker who works with radiations was involved. And so the government developed, after a long time, that the Alara concept. So try to develop the X-ray column so that it can minimize the exposure to the patient and so on and so forth. And so, but it was only applicable to as Alara is as low as reasonable achievable. So the doctor can follow with respect to patient, with respect to their own exposure to radiation. Then I thought, well, that's not enough. I should develop a new concept, which I developed and published, as you know, a concept of Primara, protection as much as reasonable achievable. How you achieve it? So for radiation protection, we develop a micronutrient formulation, which, as you know, eventually original micronutrient formulation, which was a very powerful radioprotective agent. And in a human, as you know, we tried against CT scan, but high dose radiation among mice, rat, sheep, and rabbit. So we demonstrated beyond any doubt that it is a powerful radioprotective agent. So when Dr. Code made me aware of the EMF radiation, I started studying about it, doing research about it. And then here, it is not only few people, like in terms of a radiation worker involved if you are working with radiation, but here the hazard of EMF radiation is exposed to entire population.
Mm-hmm.
Not only children are more sensitive, but people who are older, 60 years older, they're also more sensitive than, say, younger people. But it depends upon, when you have trying to prove free radicals, sensitivity is a relative term. If free radical voltage is more or less, it will cause damage. And if it is less, then it will cause less damage, but slowly, gradually, it will become accumulative. The damage is accumulative. And so then I thought that, well, maybe it is the same kind of principle we can apply in terms of EMF radiation, and try to have as low Alara, as low as reasonable achievable. That means you turn off when you are not working, you turn off your Wi-Fi or all the sources of EMF radiation, and then as much as reasonable achievable, you can do that. But knowing behavior of the people, and that's it. Well, that also will be complementary if we develop the same concept that I developed for ionizing radiation, also for EMF radiation. And that's why we develop and, as you know, published information. And because that is and this is adaptable by everybody. This program is education, public education. You should do as much as possible. Many people will follow as much as possible, but that is not sufficient. You have to give them some easily, which can really prevent the damage. And that's why, in collaboration with Dr. Cote and Jeanette, after discussing, then we developed this EMF formulation. And EMF formulation is same as original one, except those 4 ingredients that we have put it, curcumin, resveratrol, green tea extract, and quercetin, and they were directly tested. Some of them in human, other in animal model, and they found they protect against EMF radiation. So I said, well, probably other one does the same thing, but these are all non-toxic. That will make the original formula more stronger, even for other purpose, and then obviously more for the EMF radiation. So for Primara, I think it is important that everybody should take EMF radiation, at least EMF radiation. And of course, and so now we can discuss the damage. Dr. Cote, you want to do it, or you want me to?
Hang on 1 second. I wanted to put this up because some people may not know the difference between ionizing radiation. So this packet that you made right here, protected against ionizing radiation.
Ionizing radiation, yes.
Which is on the far right-hand side for everybody. Those are the X-rays and gamma rays and CAT scans. And, Dr. Court used to X-ray many people as an upper cervical doctor. But I also had to wear dosimeter because I worked at a DOE facility that had, mixed radioactive waste, high level and low level. So Dr. Prasad's original formula already protected against that. And now the EMF formula protects against all of it.
Both ionizing and non-ionizing, yes.
And I wanted people to see on here that, like with the sunshine in that area, we know that it's safe and beneficial in the morning to get out and get some morning sun, but it's the cumulative load of the non-ionizing, the EMF radiation exposure, the chronic use of the cell phone and the chronic use of Wi-Fi. I wanted to show this on a, for people, it's really all the bees in the room. The exposure that they're getting, and that you created a product that can protect against both ionizing and non-ionizing for everybody.
Even ultraviolet radiation, for example, many young people they want to become like me and expose themselves in the sun very long time. Well, the ultraviolet radiation also produces free radicals. So if you are short term, that's okay, that's good for your health. And as you know, that sometimes if you have a short-term exposure of free radical production, the reactive oxygen species, which is also called free radical, they stimulate the activate nerve 2. And as you know, activation of nerve 2 is essential for increasing antioxidant enzyme. So if you go in a sun short term, you generate this is useful. But if you stay in a 12 o'clock, in a daytime, summertime, and expose yourself for a long time, the risk of melanoma becomes very high among you people, white people. I have a protection against melanin, but white people don't. And that is all mediated by free radicals, damage to the DNA of the skin. And so even that kind of excessive use, you can see that. And same thing applied to EMF radiation. Actually, it was known as early as 1970, when the Soviet troops were working with the communication, like with the radio and the radar system. Many of them got a so-called hypersensitivity. They would not sleep, but they were disturbed, fatigue. Excuse me. Fatigue, and so this hypersensitivity issue was noticed as early as 1970. But when the troops are doing this job and they suffer, nobody cares. So it never caught up. Yes.
Dr. Prasad, as I'm listening to you already had this formula before 2001 when you were asked by the Department of Defense,
yes,
can you help protect our soldiers from radiation, biowarfare,
yes,
extreme stress?
Mm-hmm.
And I love this slide that Jet pulled out, because if we go to the left side of the slide, we can see the ELF exposure and the VLF, which is very low frequency, like our electric plugs and our electric lines. And, in our lifetime, there's a lot more electric lines and a lot more homes than there ever were before.
Mm-hmm.
And we get into the low frequencies of televisions and things like that. And then radio frequencies, which I worked in radio frequencies in 87. And then the radio frequencies went to the microwave frequencies. And we can see that it's the radio tower, the cell phone, the microwave oven, the microwave dish.
Beautiful.
And then we get into the infrared, the visible and the ultraviolet. And even though you have more melanin, those with more melanin still burn.
Yeah.
And whether you're African American or you're Indian or whatever your melanin content is, our sun is becoming more powerful, and we are becoming more sensitive to all of these different ranges, electric fields.
And I want to say this real quick before we move on to the next slide about the symptoms. Dr. Prasad, because we measure heart rate variance and we measure sleep, there's a real issue with measuring wearables because they did not take into the fact the variable of melanin, the skin tone. And so a lot of the first to markets didn't take into account the different levels of melanin. And now there are lawsuits because people made health decisions based off of that data. And so skin tone is a really big factor when it comes to heart rate variability, which is resilience and sleep. So
I think it's fantastic how in your lifetime, as a little boy who saw Hiroshima and Nagasaki and decided he wanted to do something to help people, to protecting our soldiers from radiation, biowarfare, and extreme stress, to the slight slide that now you're protecting us from non-ionizing radiation, biowarfare at home, and extreme stress at home. I want the listeners to understand what a beautiful, beautiful tapestry has been drawn here. It's incredible. I'm proud of you. I'm so proud of you.
Okay. So some of the symptoms that we've seen, but that have also been documented in Dr. Prasad's paper that he published, that is very well cited. Dr. Core, do you want to go through some of these symptoms that you've seen in your practice, that you have personally seen?
Well, not only have I seen these symptoms, Jonette, I live these symptoms. And that's one of the things that brought us to this point today. With EMF radiation, electromagnetic field radiation, the symptoms are vast. They're very much like concussion-like symptoms, and not in any particular order, but dizziness and balance issues are a huge part of what I've seen, not only in myself, but in the clinical settings. Pain. And the pain is an innocuous pain, but pain in the hands, pain in the arms, in the forearms, pain in the head when using devices. It was 1999 when I started developing pain in my hands, trying to decide how I was going to hold my phone in my left hand or my right hand. And when I put it to my head, it would literally make my head hurt. No matter where I put it, I would feel the pain, as well as eye strain. And eye strain is something that we see throughout the world because we're all on our devices. But eye strain, dry eyes. We spoke last week about myopia in children where they're developing a farsighted or a nearsightedness, irritated eyes, pupillary reflex issues. EMF hypersensitivity or EMF sensitivity is a state of shock. And that state of shock, the first part of that state of shock is, I don't believe that this is happening to me. I don't believe that I'm sensitive to my environment. I'm just going to push through this. And then the second state of shock is agitation. And that agitation comes with what we call pupillary reflexes. When we're angry, we don't have constricted pupils. When we're frightened and angry, we have big, large pupils. And like on a camera with the shutter wide open, then that radiation goes into the brain straight through the eyes and has an effect on it.
Yeah.
I think ringing in the ears is huge.
It's a huge problem.
We've spoken about that, Dr. Prasad. I'm going to have you hit on that as well as when I get through this. Headaches, migraines, brain fog. These devices, the entire world is affecting our brain, and we're living within it. We have heart palpitations. Our heart doesn't have any protection except for the myocardium around the heart. And in our measurements of heart rate variability, we see it often that people have issues with the heart, the pericardium, and the small intestine.
Meridians.
These meridians that are being affected. And then, as I said, anxiety, agitation, irritability. That's the second phase of shock. And then the third phase of shock is unconsciousness, where the body has to shut down in order to protect people. And those are some of the symptoms that I've seen. But I think probably one of the biggest symptoms on this list that is affecting at least, I would say more than 1 in 2 people.
That's fair.
More than 1 in 2 people is insomnia.
Yeah.
We cannot get our brains to calm down as a result of our electrical environment. So Dr. Prasad, would you take us through this a little bit? And...
Hey, hang on. I'm going to get to his paper.
Okay.
Because we only have until 10 till. Okay. So, drum roll, please. So this is Dr. Prasad's paper, and I cannot read the journal up there, Dr. Prasad. I hope you guys can see it. I have you can't.
Yeah, I can see it. No, I can see it.
Okay. And so that I apologize that I'm not going to read the journal name because it's covered on my screen because I'm screen
It is World Journal of Pharmaceutical and Life Sciences.
Thank you, Dr. Prasad. So this is Dr. Prasad's incredible paper. And when I mean novel, I've been waiting for this paper. And I know that when he sent it to me, I've read it like 5 times. It's so dense. But would you just walk us through this incredible paper? And it's so well cited, 89 citations. You did an incredible job, but just walk us through why you wrote this paper and the importance of this paper.
Yeah, the reason I wrote this paper because, so much data was emerging that it is EMF radiation is very hazard to your health. And although some discussion was going on epidemiologically, most of the people say, yes, it is true. Some people say it is not true. But the thing is that it is so variable. You can't control how much one person that you are studying it getting exposed at one time. Daytime he goes someplace, nighttime he goes someplace. Variation. And variation, if you don't know how much they're getting, you can't detect how much is being absorbed in your body. So epidemiology is good to start. But most important thing that convinced me about this thing is that the results of the animal model, and later on some human study as well, in any model, the National Institute of Toxicology in North Carolina, and funded by NIH, they have a huge toxicology lab, and they did a very careful study. The the EMF radiation dose was around 900 millihertz, and also, but there they control how much in energy animal is getting, how much frequency we are exposing, how long. So we are well controlled study, and in that control study they showed that yes, there is an increased risk of meningioma, some other brain tumor, and other kind of tumor as well. And so that convinced me. And as you know, also the International Organization of Cancer Society, they also defined EMF radiation as a 2 big carcinogens. And not only that, as you remember the story of the Havana syndrome, they thought that this was all plot to kill us. Then it became a Chinese syndrome, then become a Washington syndrome. So the government appointed a different discipline of top scientists to examine what the source of this damage is, that people are feeling it. And after the discussion for about 6 months, they came to conclusion that it is likely, they use the word likely, EMF. Scientists never say for sure, So likely, so now we have even government-sponsored organizations say EMF is a real culprit in inducing hypersensitivity, acute, as well as late effect that we have not observed as much as we can do in this study. Yeah.
Prasad, they also gave a diagnosis.
Yeah.
Okay. And we didn't have that before. Persistent perceptual postural dizziness and associated anxiety and depression. That was the diagnosis. And they said it was not psychosomatic.
Yeah. And so in these situations, that's why it is EMF. But because of the multiple factorial, it is not just the increased oxidative or cellular inflammations. You have also problem of a sleep disturbance, agitation. They may not be controlled fully by just EMF. For that, if you have this kind of symptoms in the person, agitation, irritable, then you have to take a help of the CBD, because CBD is very well known to control this in human. And as you know, if you want, we can explain the mechanism why that is. So that's why even in this scenario, when you develop concept of Primara, at least you can take this much. And if you have symptoms of irritable, then you take the CBD. But if you don't have symptoms, then you don't have to take CBD. But sleep disturbance, like you mentioned, again, in addition to taking EMF, I think if you have a sleeping problem, that may not help as much as if you take a sleeping formula, the sleeping boost that we have developed it. And suppose if you have both irritable, then I take the 2 capsules, 50 milligram of CBD and sleep boost, and I sleep like baby. I don't have sleep disturbance, but right from a young age, my sleeping was not good. My wife always complained, but now I sleep very well. Nobody can complain. So I think, so it is a multifactorial. Therefore, to address any health condition, whether it's EMF induced or some other issue, that we have to address all their problems, all the stress factors that are contributing to it.
The stressors.
So if you have a sensitive to, and if you are older person has already intestinal dysbiosis. So not only you have to address this protecting against the EMF radiation, like free radical inflammation produced, but you have to protect also your gut. And how you protect gut? You have to take dysbiosis, you have to take this product that we developed.
So Dr. Prasad, do you want me to go to the next slide? Is there anything else you want to say about this before we go to the next slide with Alara, Primara, and then the core 4?
No, the damage is, this is for real. In other words, they call it hypersensitivity, and you discuss all the symptoms, but also cancer, non-cancer disease, and one story is there. One case of story was a woman was keeping her cell phone near her breast inside, and she developed a cancer of the breast. There are a lot of story like that, but point is that it is a well-known. The question is how we can protect it. We know it is there.
Yes.
How can convince people to take it?
There's a couple of things that we can do. And one is reduce exposure.
Hang on. We'll
Yes.
get to the next slide.
Alara.
We'll get to that.
Okay, we're going to get to that. We're going to make this actionable for everybody on here.
Yes.
This paper is novel. No
Yeah.
one else in the world. Dr. Prasad had discussed Alara, which is as low as reasonably achievable, which is like shielding. And he
Yes.
even presented Primara, which is protection as much as reasonably achievable, with a micronutrient for ionizing radiation.
Yes.
This approach now for this EMF exposure is
Exactly.
the first in the world for
Yes.
everybody on this. And this paper is extremely well cited. So I wanted to give you that. And I've read it numerous times. It's a dense paper, Dr. Prasad. But
Okay.
I wanted to go over what
Yeah.
does that mean? What does Alara mean? And you helped me, but I wanted for people on here, what are the actionable steps? Alara means to reduce your exposure via time, distance, and shielding to
Yes.
reduce health risks from EMF radiation. That's
Yes.
what we're sharing with people, especially at night, because
Yeah.
that's when we heal. Number two, so Alara reduced that exposure.
Yeah.
And Primara, which it means to protection as much as reasonably achievable, which is the scientifically validated micronutrients
Right.
to reduce health risks from EMF radiation. By the
Yeah.
combination of those two, right,
Yeah.
Dr. Prasad,
Yes.
we have a really good chance for resilient health.
Exactly. That's completely true.
So when we look at Alara, it's digital hygiene, folks. It's and it's simple. It's really simple. Limit the amount of time that your earbuds are in your ears next to your brain. Don't sleep with your phone in your bed or
Yeah.
next to your bed.
Yeah.
Minimize electric fields. If you have lamps next to your bed, unplug them. If you sleep in an electric bed, unplug it
Yeah.
so that it's not giving you voltage, because it's all the bees in the room. It's all of the accumulation.
Yes.
And then, if you're going to carry your phone in your pocket, put it on airplane mode. When you
Yeah.
take it out, you can turn it back on. Or just don't carry it on your body and put it in a bag of some sort
Yeah.
away from you, and then sleep with it away from you, not next to your head, not on.
Yeah.
This is digital hygiene in a basic sense,
Very easy to do it.
and it is easy to do it. And then Primara.
Hang on. And so then we'll get that. But Alara, for everyone on here, start with the bedroom at night.
Yep.
You don't need to have it on. And master that, because we measure sleep. We know that's when we heal. So you can make those changes very easy in your home for your children and for your pets and for yourself.
Yeah.
And
Whole
now we're
family.
gonna go-
It's
Right?
way easier than quitting smoking.
It's way easier than quitting smoking. That is.
That's true. That's very
And now
true.
let's go to Primara. So this is Dr. Prasad's Core 4. You want to go over it real quick, Dr. Prasad?
Sure. You can see that EMF is, of course, it will protect against free radical and inflammatory damage. And the next one is probiotics, which will protect you against any harmful bacteria that will grow in your stomach, and they will be reversed. So now they are producing very useful molecule for your body. And because in any old people, intestinal dysbiosis is involved with or without disease.
Mhm.
And when you have a free radical, for example, during radiation therapy, which is ionizing radiation in this case, but nevertheless, they produce a lot of free radical, they enhances the level of intestinal dysbiosis.
What about this?
Yeah.
Non-ionizing radiation pointed
Yeah,
at
but,
the belly.
Again, continuous exposure to that can also interfere with the intestinal dysbiosis. So probiotics becomes very essential to correct the probiotics, and also probiotics will reduce the inflammation, so that at least the free radical induced, the EMF induced inflammation will reduce to an extent in combination with EMF. It always has to be combination with EMF. Then the fourth one is the third one is the collagen peptides.
Well, the omega.
Or third one is the omega-3. Omega-3 is a very essential amino acid, fatty acids, very essential, that our body does not make it. We rely totally on either supplement or in the diet rich in fish. But you can't eat a diet rich in fish every day. Not possible. Some people could, but not possible. But if you take too much fish, there was a report, interestingly, because sometimes fish could have a mercury contamination. So if you eat too much, there is a contamination of mercury problem, which is another health hazard. So take a limited amount, like I do, once or twice a week. And also, when you buy a salmon, make sure it is not farm-raised. It is a wild caught. And because in a farm-raised, there is no omega-3. And so these are the things. So omega-3 absolutely essential, and it will also help in terms of overhaul. The brain function is very important. So all in combination, it will protect against also inflammation. And as you know, EMF radiation does cause inflammation as well. So omega-3 becomes very, very essential for health of not only brain health, but also heart health, because especially EPA component of the omega-3 is extremely important for heart. Mm-hmm. On the other hand, DHA component is more important for the brain. So we have both, as you know, in our preparation, and that's why it is very important. And the collagen is beyond description. Collagen is every place. 30% of total our body protein is collagen. This is present every place. And all the disease that I have analyzed, most recently hearing disorder, loss of collagen you can detect. You can see that my hand is not anymore. A lot of collagen loss before I taking the collagen that we have made, collagen peptides. But so we can detect it, but if the losses occurring in the brain, heart, the ear, you don't know it until you have a disease. And so it is very important. For example, in a case of diabetes, it can stimulate the flow of insulin from pancreas to the blood. That's very important function for this. And omega, I forgot one function is that if you become insulin resistant, for example, that omega-3 can directly activate a molecule called AKT, which then goes and does the job, and then glucose can enter into the cell. So this is very important. For EMF radiation, collagen peptide is important because collagen peptide can also maintain all the structure of your body in an intact form, so they are a little more resistant to free radical damage or the damage caused by loss of collagen. And in dementia, for example, it's very linked with the loss of collagen. And different. So it is. That's why for core 4, you must have a core 4 for the protection against Primara, say, in case of EMF radiation. And also, if you have an addition to that, I also recommend most of the older people, especially, they do not produce sufficient amount of digestive enzyme. And therefore, core 4 plus 1 becomes absolutely essential. And then in case of you have a special case in agitations, the EMF will cause agitation, irritation, this kind of thing, even pain like that. The CBD can take care of all these issues. Mm-hmm. Especially the agitation and irritable and aggressive behavior and pain. These 4 things they can take care of that very easily. There's a lot of data to support that.
And safely.
So +2 and +3.
Which we call the ultimate.
Which is our ultimate bundle.
Yeah.
That when we look at sleep, which both of us measure.
Sleep, 3, yeah.
Sleep is just critical because that's when we repair our brain. And
Sleep is
we're looking, go ahead.
among all the things, you are correct. Sleep is the most sound sleep is most important thing for your productivity in the workplace, for continue to have good health, good quality of life. Sleep is excellent. So yeah, 4 plus 3.
All
Wow.
right.
Well,
Woo!
we are on time, and
Oh, this is important, very important. I mean,
it is important.
especially older people has more anxiety of all kind of things growing. Some people, I don't, but some people worry about getting old because they have all kind of disease. So goal is to have this core four. Not only it helps you against EMF radiation, against ionizing radiation and so on, but it also helps to improve your quality of life as long as you are living. As long as like your, aging phenomenon.
Longevity.
Optimal longevity.
So you have to, for optimal longevity, you have to start it earlier. I mean, I didn't start very early. I started because I was ignorant myself. And so when I'm knowledgeable, which was maybe in 50s, and then I started taking some kind of vitamin.
Hang on, he just said 50s. For everybody on here, you can start today, right?
Yeah, you're going to start today. Yeah. When I went to college and I started doing some of these studies and became aware. So I would say that I started taking vitamin maybe in 1970. But I'm suggesting you don't have to wait that long. I think everybody should start after 30.
But in the 1970s, we were looking at vitamins that were like Pintos.
Yeah, like you're buying in a store. Buying in a store.
Now we have, the Lamborghinis and the best nutrition in the world.
The Lamborghini.
The best nutrition in the world we have. And, this has been such a fun journey, this discussion tonight. I think this was one of our best talks, but.
Well, it's definitely the most passionate and dear to our hearts, because it wasn't that long ago, 8 years ago, when Dr. Court was getting these symptoms, but we were seeing patients with these concussion-like symptoms without physical trauma. And we now know that for concussion and mild traumatic brain injury, they now include infection and toxins as risk factors that are the root causes. So it makes our work much easier when we're presenting to our peers, because we kept on seeing this data, and now with your paper and your strategy of Alara to reduce your exposure, I'm going to say specifically at night, just go for it at night and just make a sleep sanctuary. And his Primara, which is to protection as much as reasonably achievable through a micronutrient.
Yes.
A scientifically validated micronutrient.
Exactly.
Those two together, you can have a resilient health.
How blessed are we to have the world's foremost authority in radiation, the world's foremost authority in non-ionizing radiation, the world's. You are a treasure, a worldwide treasure.
Thank you.
And we're so grateful that you've been on this journey, that you've been our guide through this journey over the last 8 years. But, to create the nutrition, you already had it created for your students. Then you were asked to prove it, and you proved it for our military. And then, you met Dave and things were created, and now we've gone full circle. We are so blessed. All of us on this call are so blessed. And those that you haven't met yet are so blessed to have this caliber of nutrition and your knowledge.
With many patents. Our children's EMF product is patented.
Yeah.
Our EMF product is patent pending, coming on the way.
Yes.
Our probiotic boost is patent pending.
Okay?
Yeah. Our omega-3 is patent pending. Our collagen is patented.
Yep.
Our sleep boost is patent pending. And we're just, it's incredible that we have such products that are also safe. And that's one of the last things I want to talk about.
The lesson.
Okay? Thank you.
One of the most important things to me, there's so many people that are on a lot of medication, and your product is safe. And
Yes.
also, you put it together, the suite, so that the combinations are safe. So when
Yes.
someone tries to take somebody else's product line, they could be taking too much B6
Yes.
because you put that in our Sleep Boost.
Right.
It need to be in Sleep Boost because it's in our micro daily EMF product. Every day we get the right amount, and
Right.
you need B6 and tryptophan to make melatonin.
Right.
But most people take different products. You've made it simple that the synergy, that it's safe.
Yeah.
You know,
Gotta go.
no
Just gotta
more,
go.
no less. You're perfect. Thank you, Dr. Prasad.
Thank you,
Have a
Dr.
great
Prasad.
dinner tonight. We love you. We
Thank
appreciate
you.
you.
Thank
Good
you.
night.
Thank
Folks,
you. Good night.
do you have anything else you want to add?
Yeah, I
Beth?
want to recap real quick. Thank you, Dr. Prasad.
Thank you.
You will. Great call.
It was. I'll say for everybody on here, let's recap what do the brand new big words mean? Alara. Well, we've known them because we've worked in radiation, but it means as low as reasonably achievable. But what that means is to reduce your exposure. Reduce your exposure, time, distance, and shielding. And what I wanted, what I wanted to say specifically at night, start there. Sleep in a cool, dark room, no Wi-Fi, reduce your exposure to blue light at least a couple of hours before bed, unplug the lamps, and do those things because that's when we heal. So Alara is really physical behavior to reduce your exposure. Primara, really protection as much as reasonably achievable, which this is his pioneering work. And the two of those together with the most scientifically validated micronutrient suite of products, that when you put those together, that you will get to be resilient, even in the world of the electromagnetic fields that we have. It's all the bees in the room, and that we can't get rid of, that you will be able to live a healthy, resilient life.
You know, Jet, there's one thing I want to add, and we haven't really added it, but we'll talk about it. But our pets.
Yeah, pets.
Folks, your pets cannot get out of the electric fields. So if you don't do it for yourself, do it for your pets. Unplug, unplug, unplug. Shield your pets, because they have no way of telling you that they're not feeling well.
It's not as much shielding as reducing the exposure.
Reducing the exposure. Yeah. But,
and you could
numbers
use the purple, and you could use the purple formula for the pets.
Totally safe. So we've been using it for Kaizen.
So you could combine those to help your pets as well.
And it's important to understand that they're being affected just like we're being affected, and maybe even more because they stay in the house when we're at work and they have no way to protect themselves. So,
and you may notice that by behavior. They may not be minding. They may be peeing or doing things that they normally didn't do before. So the first thing you may notice is that kind of behavior. And then number two, when you go to the vets, we just see a lot of cancer. Cancer is really on the rise in our pets, and it doesn't have to be. You can protect them too. So with that being said, you want to close us out?
I do. I want to thank everybody for being on the call. Make sure you invite your friends next time. This was just a great call. Happy to have you all here with us. Thank you so much.
And we'll be on next Tuesday night with Dr. Prasad, and we're going to be talking about his latest paper on hearing loss and tinnitus and strategies to be able to help people that are suffering with that, because they do suffer.
Okay.
And please get back to the person that invited you on this call.
Make sure you do that. Have a great night and be well.
Be well.
Thank you, Jeff.
Thank you.